Can everyone hear us online? Okay, perfect.
That's dead.
Okay, hello, everyone. Welcome to the March Pedestrian and Bicycle Advisory Committee. Closed captioning is available on the desktop version of Microsoft Teams. To enable captioning, click the three dots on the top of the window and click Turn on Live Captions. Unfortunately, captioning is not available for the web browser version of Teams. Okay, call to order time is 8:33, and I will do roll call. Aaron Artiega. Okay. Anna Beliakova. Emily Cadman.
Here, present.
Mitchell Henke.
Present.
Montavious Jones.
Here.
Kathleen Minnick. Ben Teal.
We're gonna get a quorum?
Barry Weber.
Present. My camera doesn't seem to be working on this computer I'm using today, but I'm here.
Stephen Owen.
Here.
Public safety representative is still vacant, and Monica Walk-Smith.
Present.
Yeah.
Yeah.
Around.
Oh, yeah, present. Sorry.
So it's around, yes.
Okay. Okay, and I'll turn it over.
Cool, thank you. Welcome, everybody. We have a pretty short agenda today. We only have one kind of item outside of our normal things that we're gonna get to at the end, because Jessica has, the Vision Zero item will push to the end, because Jessica has stuff going on presently.
Although Mitchell, I am here and can go whenever you need, but the end works also.
Oh, cool. Thanks. I guess we'll leave it at the top of the agenda then. But the first item to do is approving the minutes, or approving the minutes from last month. If anybody was able to take a look. They exist. They do exist, and they look right to me. I move to approve the minutes. Do we have a second? And I second. I'll second approving the minutes then. Okay. All right, let's see. So before we get into it, actually, I just wanted to share quickly that the grant for the 6th Street reconstruction that we wrote a letter of support for in, I think, September last year, was awarded to Milwaukee this week. It's going to be it's a major one. It's in the downtown plan. If you're looking for details, I guess there's also a lot of media coverage too, which is probably easier to find. But 6th Street North to National. Good to see. And with that, I guess if Jessica, you're here, do you mind getting started on kind of talking about the city's Vision Zero plan?
I am happy to. Is it okay if I share my screen and go through the presentation?
Yeah.
Sorry, this will just take a second. And I apologize. I am sick and just a little slower than usual, but happy to still have this chance to chat with all of you. And please ask questions as we go. Good morning. I'm Jessica Weinberg, the Vision Zero Policy Director. It's a real honor to work for the city of Milwaukee and support goals I know we all have, especially eliminating traffic deaths and serious injuries by 2037. So today I'm going to give a little Vision Zero overview, but I won't go too in depth. I think a lot of you understand the program, and I'm going to dive more into some current projects that we're doing, how you can help increase public input. I'd love to demo our traffic violence dashboard with you. And maybe you've heard about the county one, but this is a slightly different city one, and I'm really curious about your feedback. Then I have a list of about 10 just tough facts that have emerged out of mostly the crash report that DPW did that I think we really need to wrestle with. And I'd love people's ideas from this group. I think it's we definitely need brainstorming around these tough facts. And then kind of just a preview of what's next for Vision Zero in the city. Okay, so let's start with that overview. I think these are the key concepts that probably everybody understands, but I just want to make sure, because we do have to kind of be on the same foundation to appropriately institute Vision Zero and the systems changes that we need. So death and serious injury are unacceptable in our roadways. What we see happening are crashes, not accidents. These really are preventable. Equity is at the forefront of what we're doing and embedded in all the research we do and how we're deploying solutions. Our main thing that we need to change is speed. Lowering speed is the key to saving lives on our roads. And how do we get that message out to the public, I think is a really big question and something we can work on together. And then Vision Zero is definitely multi-sector. It takes, although we want systems change, which often is easiest to do in the built environment, it's not just a DPW effort. It's not just about the built environment. We do want to work with police and researchers and community members and the libraries and the health department and figure out a strong solution or a strong series of solutions. I guess that's the other thing with Vision Zero. Clearly, we cannot eliminate something as serious and complicated as traffic deaths and serious injuries with one sort of solution. We need a multi-layered approach. Lowering speeds is the realm we want to focus in, but we really need lots of solutions to get there. Are there any questions about this? Okay, so that was the basic version of Vision Zero. And now I kind of want to introduce to you the more expert level of looking at Vision Zero and how we think about potential solutions. So this is a model that some public health researchers have developed, and it's taking a general public health pyramid and applying it to Vision Zero. And I think it can be helpful in your own mind to possibly to think about COVID and how we responded to that with this sort of model. So the idea of the pyramid is that the base of the pyramid is where the most people are getting impacted. And that's where you want to work towards the base so that you can influence the most number of people. And that's what the base of that right triangle getting wider kind of shows us, that there's more people at the bottom of the triangle. And then that's inversely related to how much individual effort is needed. So things at the top of the pyramid, the individual really has to make the choice to have that safety benefit, whereas the things at the bottom are just latent in the system and provide safety for people. You can also think about this like with airplanes. You personally don't have to do anything to make your airplane ride safe. All the safety is built in. It's not up to you if that is a safe experience or not. So they've built in, the built environment for the plane is safe. Latent safety measures are there, things like that. But let's look at this with the Vision Zero concept. And I just want this to kind of, this is something you can have in the back of your mind as you're either analyzing what sort of actions the city is deploying, or if you're thinking about some new ideas, how does it interrelate with this model? So at the base of the model where we can affect the most people and they don't have to do anything specific to have those benefits is socioeconomic factors. So this can be zoning policies, trying to have dense housing or affordable housing near transit, policies that reduce VMT. Maybe this could be, you know, a very accessible or frequent transit service, some things like that. Not having to spend a lot of your money on transportation, that could also help people. Next up from that, we have the built environment. I think that makes sense to a lot of people. You know, do we have bike lanes? What sort of bike lanes? Do we have sidewalks? You know, as a city, we're very lucky. We have sidewalks everywhere. So basically everywhere, not actually everywhere. But that's not a battle we're fighting too much. But, you know, it's very clear roads with sidewalks are safer for people walking. So things like that. When we move up one more level to these latent safety measures, these are things that are built into the system, and the person doesn't have to actively do anything to have the safety benefit. So this is, you know, a signal timing that might be focused on keeping traffic speeds lower, or airbags in a car. That airbag is going to deploy when it's needed. It's built in. You don't have to say, yes, I'd like that airbag deployed in this crash. So those are great safety measures. And then we get up to active measures. So these have, you know, less and less of a population health impact. And here's helmets. You know, helmets work if you wear them, and if you have them properly fitted, and if you aren't hit so hard that the helmet is immaterial and you have so many other injuries, or the helmet can't withstand them anyways. And then at the very top, education, where we have to individually teach people, and then they individually have to have the right behavior. And you can see that that takes a lot of work, and it has minimal kind of impacts. And the point of going through this too is to highlight that in the past, our traffic safety programs have really focused on education and active measures almost exclusively. And you can just, this model kind of shows that if that's where you focus, you are just going to have limited population health impact. So with Vision Zero, we're really trying to broaden this pyramid and go deeper on these other measures that have more of an impact on population health. Does anybody have a question about this? I'm sorry if I'm going too slow on this. So just know this is in the back of my mind whenever we're thinking about solutions. What is that population health impact compared to the individual effort? I think you all have also seen this slide. This is just important crash context for Milwaukee and why we're working on Vision Zero now. Really, since 2015, there's just been a new trend, a terrible new trend of increased traffic deaths that really weren't common before 2015. So basically, our new lows are higher than our past highest highs. And that's just a terrible new phase that we want to get out of. And then I also think this is really hopeful because in the recent past, as recent as 2013, 2009, we were more at 35 deaths, 32 deaths per year. And that's, you know, almost, we're at 80. We had 80 last year, sadly. So 32, you know, would be almost 50 less people dying on our roads. And that's in our recent past. So I have like full faith that we can get there, and then we can continue our march towards zero. But we're really in this new era, and that's why we're needing to deploy a lot of new and different techniques because things have just gotten a lot worse. So some current projects that I'm working on, and I will say, you know, right now, Vision Zero is a team of one, although that is changing, and I'll talk about that in a little bit. But I'm doing a lot of community and agency involvement, doing some education development, focusing on strategic communications, including this traffic violence dashboard that I'll show soon. Hoping to do some polling and message testing. How can we most effectively communicate about why we're making these changes and keep people in support? And then really a huge thing I'm doing right now is the action plan, and creating an action plan, and we're in the public input phase. And I just want to share a little more about that. Oops, sorry. So our action plan process, what are we doing? This is the overview of what the process has been. I've really tried to take the recommendations from past plans and that were related to Vision Zero and carry those forward. We had 2 open houses that had people review that. We're right now in the public comment phase, and people have been reviewing these 50 recommendations and giving other comments and ideas, and soon we'll be moving into writing and finalizing the plan, and then a continual cycle of adopt, implement, community outreach and input, and then updating. For public input, I have a personal reach goal that I'm a little nervous about, but I need your help to get 1,000 people providing input across the different channels by April 15th. We're at about 200 people right now, so I really could use your help. We had 2 open houses. Those were completed thanks to people who came or shared information about those. The main thing to share right now is an online survey, and I'll share an invitation with Mitchell that you can send out. You can share that, via email, or we do have some little social media images too, or you can go on the DOA Instagram or other channels and share from there. And then another thing, it's really important to have, equitable representation of the city in our Vision Zero plan. So I'm doing some targeted outreach in neighborhoods that are traditionally underrepresented in online only surveys. Excuse me. So I've developed an in-person Mentimeter survey that I'm delivering to community groups. And that's a way for a whole group at once to take the survey. And also because it's Mentimeter and the results are displayed as we go, it leads to a really interesting conversation and sharing of ideas and concerns. And I'm really thankful, especially to Safe and Sound, for helping me set up a bunch of neighborhood-based meetings. But if you're part of a group or a neighborhood that you think would benefit from this, please be in touch. I am trying to get all these done again by April 15th. And then I'm also scheduling office hours at 10 libraries, with the goal of intercepting library patrons and asking them, hey, do you care about safe streets? Are you interested in taking this 10-minute survey? And then having them use my computer to go through the survey, making sure that the digital divide isn't a problem. And also the version of the survey is easily translatable into other languages. So I'm hoping to perhaps get some more different language participation as well.
Jessica,
Any questions? Yeah.
have you done one of the in-person Mentimeters yet? And can you tell us how long it takes and what's required of the group?
Yeah, minimum is 20 minutes. 30 minutes is a little bit better, because the conversations have been so positive and engaging. And then, I do need a projector or a way for people to, see the shared results. It could be a large screen. It can be virtual. I haven't yet done it virtual. And my idea is that the online survey should be able to get to people digitally. And the purpose of the Mentimeter is to be in community and having these discussions together. But it can work as a digital or hybrid option as well. And people do need to have their phone to vote. But that has not, I did this at Rooted and Rising, was my first test. And I think there was one person who didn't want to use their phone, and the person next to them was kind of able to vote for them as well. So that is one small limitation of this. people need phones, but it's kind of shocking the high level of smartphone access in the city. It's much higher than computer, so it's better than the digital one, the online one. Do you have other questions, Montavia, since you're...
No, that's it. Thank you.
Okay, and I want to thank, I did kind of test the Mentimeter with one of Bob's Bob's Bike Ped classes and with the Elevate Health team. And they gave really good feedback and have helped me reach out to other communities as well. So what's next? One thing is the DPW anti-speeding education campaign. That'll be a really public thing, talking about the dangers of speeding. And, you know, it is at the point of that pyramid that we talked about. But now is the time to actually think about doing something at that point of the pyramid, because we're doing so much effort on every other level of the pyramid. And with safe systems, we want to have like all the approaches layered together for maximum input. So there's a reason that this anti-speeding campaign wasn't done 3 years ago. Now is a good time to do it because it's backing up a lot of designs that are encouraging slower speeds on streets. A key thing I want everyone to know is that we're hiring a community outreach specialist. It's a really great job. The pay starts at $50,000 a year. You can apply, you need to apply by 3/28. And I encourage you to share this job posting or consider applying. Having, you know, caring about your community and having community connections and liking to talk to the public and teach is more important than like specific knowledge about Vision Zero. That can be taught, but take a look at the job posting and please apply or share if you're interested. It would be great to have you join the team. Another exciting thing is to work on integrating art making and the art car. At our public meetings, the artist in residence had a printmaking station, and it added a really nice element to the open houses. I want to thank all the DPW staff and other volunteers who came to the open houses and worked them. Thank you, thank you. But we're going to soon have an art car, and the community outreach specialist actually is very likely to be the main person driving this cool art car. So think about that when you, if the job interests you. It's very unique. So how do we integrate art into, you know, talking about our community and making things safer? I think it's a very open area we can do more work in. I'll be analyzing the results of this public input, using that to draft a plan, doing ongoing communications research. And then another element that I want to focus in on more is how to involve victims and encourage them to do storytelling about the real impacts of our current system and why it's worth making some very minor trade-offs and changes to keep everybody safer. So now I want to briefly share, are there any questions about Vision Zero in general or any of this?
I have to ask, can you tell more about the art car and how that's going to work?
Yeah, so DPW has an artist in residence who's been working for a year on building this really cool art car. And I'm sorry that I don't have a picture. There's just like a rendering of it. Actually, I should go and get the current pictures. Okay, what it's going to look like is it's a kind of small size pickup truck that has, the artist has been building an exoskeleton frame that then she can attach a bunch of orange traffic safety cones on top of. So it's kind of like a Mad Max hedgehog safety thing. It looks really cool. She also is putting lights, color changing LEDs into each of the cones. And because the cones are carved, the changing light color like really shows through the cones. The carvings on each cone are of different Milwaukee landmarks. And it's meant to, you know, be something that people see at a street festival and want to come up to and understand what's going on. And we can have, you know, conversations with them about what's going on in their neighborhoods and what changes they might like to see. And it is the goal is that it is street legal and can be driven around and then used as an outreach tool. And the main requirement for driving the car will be that you're a City of Milwaukee employee. So Monica, if you're interested or there's some event where you could use it, it will be a shared resource.
Awesome, thanks.
And it should be ready by June 30th. And there'll be definitely, media around that, because it's a cool thing to unveil. Sarah Davitt is the name of the artist. And there's a little display about her and her assistant, Angie Livermore, on the first floor of City Hall in the Rotunda. One of the glass cases by the south door has some information and some renderings if anyone wants to check it out. And they could present in the future too. All right, I think we can go to the crash dashboard. So this is a still of the crash dashboard that I wanted to share. It's a common practice in Vision Zero to have a traffic violence or death and serious injury map. It's depressing but important. And this is one that I'm so thankful for Kate Pawasarat, also in DOA, for building. So all these filters are things that you can change. You can change the date range, which districts, these are aldermanic districts. Was it pedestrian involved, bicycle involved, motorcycle involved? And I guess I can switch and do a live little demo. So let's say we want to see how many people were killed last year. We can just quickly do this. So 80 people were killed in all of last year. And right now, someone might notice that we only have 2 listed for this year. Let's see if I reload, if it goes back to the, and this is because of where we get the data from. So we pull from.
Hey, Jessica?
Yeah.
We're still seeing just the still.
I'm sorry. How do I reshare? I messed up how I shared. Let's stop sharing and share again. Let's just do entire screen and make it easy. I don't know, it's kind of being annoying. I don't know if this is gonna. I don't think you're not seeing it, are you?
No.
Wow. Or maybe running low on time. Anyways, I can also share the link in the chat. And if we want, it could be pulled up and anybody else in the room could interact with it.
I mean, I think it's kind of striking seeing the number of injuries in just less than 3 months. Is that right?
Yeah. So at least I should go back to sharing this. Maybe I'll finish the presentation and we could come back around to this anyways. Sorry.
Yeah, that sounds good.
So yeah, this is, just what we have in 3 months. And there is a lag, especially with deaths on our roadways, because it takes, more work and time to fill out those crash reports because there's a much higher level of investigation. So there's some fatalities, like especially the 2 at Sherman and Villard are not on here. And that's just because they aren't yet in the DOT system either. And that's where we pull our data from. So it's important to know that this is always lagging, but still tells, a very interesting and sad story. Another thing to know, is just that this is the data that we're able to get from this is from the WisDOT Transportal Bureau of Transportation Safety has this Compass community maps, and you're welcome to go to that too. It just mostly gives county level data unless you have a login. And so the main thing we're trying to do is to simplify the interface and give people city level data without a login, and then really focusing on the injury causing crashes. It gets really noisy if you put in just property damage crashes, and that's what all the other dashboards do. And from a Vision Zero perspective, we honestly almost want to, I mean, I actually do want to ignore property damage only crashes and focus in on the life-changing injury and fatal crashes. And as we address those, you know, everything else will get better as well. Are there questions about that?
Do you know when this will be live officially?
Yeah, like so we are kind of talking, I want to give it some space from the county one that was just released on Monday. I don't want to, like, it just seems weird if people might think that they're competing. They're not. They're really doing two different sorts of things. So I want to give it some space for that. And we'll see. So probably I'd say 2 or 3 weeks.
Sure.
Okay, we'll go back and see if we can play with that. And then I had mentioned before that there's these top 10 plus tough but essential facts that I've been dealing with. And I'm sorry, this is a lot of text and not what you're supposed to do. But I think this group.
Yeah, we still see the map.
You still see the map.
Jessica, if you try unsharing your screen and then resharing, that often will fix that issue when it's stuck.
I have the red box in the right place, but okay, I'm not sharing. And now I'll try again. Let's see. I'm sorry.
Now we see the slides.
Oh, and now it's doing it unique. Okay, it's doing it from the beginning. Let's hop along. Okay, so this is good. You're seeing it in full screen and stuff.
We were, but now we see them, yeah.
Okay, it's just a little lag, I think. So I don't want to read these. I want you to read them. But maybe read through these and see like what's the most surprising. Do you have solutions for how to deal with this? How does this fact influence how you think about the problem? So I'll just be quiet for a minute or two and let's read through these. So do any of these stick out to people as especially surprising? And I guess I just want to share, part of why I want to share these is I think there's a lot of like anecdotal information that gets shared around crashes and who's doing it or what the problem is. And we really want to be data driven. And there's been a lot of great research. And I think we're acting on a lot of it. And to me, these were some unique, either key fundamental things we just have to really base our work on, which is maybe the top 3 or 4 especially. And then some more like just kind of surprising things that I think we need to integrate as well. And yeah, does anyone want to share what was most surprising or interesting to them from this list?
I'm surprised by the seatbelt one. That's
That's my most surprising stat.
like, I would not have. Yeah,
Yeah, and that was a reporter just did that analysis, and it was shocking to me as well. Like, I thought that was one of the traffic safety battles we had won. And, that isn't true in our fatality data. On the good news, this can make all of us like remember that when you drive, if you do buckle up, like you really are reducing your chances of dying, that it is super effective. But in general, I'm kind of focused outside of car users, but we do want to protect car users. So there's some questions. Yeah, what can we do about this low seatbelt use? And there's a UWM grad student who's doing some research on this, looking at the crash reports to understand who's doing this, and and to think, are there any examples of effective programs in this area? Others like
10% of the streets. I knew we have the high injury network, but I didn't know it represented this much of the injuries or deaths. I thought it'd be closer to maybe 10%, 30%, but this is almost 60%. So it seemed like we really know exactly where this stuff has happened. So if we have like targeted improvements just at that, like first and foremost, getting those bad boys down.
Yeah, agreed. That crash report is a great piece of research, and it really, I think, takes the whole wide world of thinking these crashes are so overwhelming to realize, wow, it's 10% of our street network. We really can chip away at that pretty effectively. And yeah, go ahead.
Oh, I'm so sorry to interrupt. Would you mind if I shared a screenshot of that slide with the group? Because I think some people, the display is cutting in and out.
Yes, that would be
I'll go ahead and do it. I just wanted to check with you first.
Yeah, thanks. No, thank you. And this really is my last slide as well. I'm so sorry about that. Does anybody have any ideas that come from looking at this data, like either an area we should be looking at or a solution? It's interesting to brainstorm in a group like this and see it.
Jessica, not an idea per se, but just looking at number 10 really quick for the DPW street design countermeasures are working. And I think a lot of us can, with our own eyes as we bike around or walk around, can feel that. I'm just wondering, do we have data so far on any streets in particular where the countermeasures have really, we can see like made a real stark difference, or some of our greatest success stories so far?
So I would say DPW has done great research on this. Do any of you want to answer? My answer overall would be, to give you a minute, is that they've done before and after studies at a bunch of projects, and the data is good at all of them. And this was shared in Urban Milwaukee and some other articles. And it's too much for my small mind to summarize, except that speeds go down, crashes have gone down. Does anyone from DPW want to be more specific?
As Mike Anderson with DPW. Yeah, I don't want to rattle off stats off the top of my head without getting them correct, but yes, there's been several articles recently. Some projects that come to mind, pretty significant speed reduction on Blackstone Boulevard, pretty significant speed reduction on King Drive as part of just a simple restriping project, as well as Oklahoma Avenue near Humboldt Park. We have several others as well. And Jeremy's on if he has a quick link to hit one of the articles he did, but yeah, there's a lot of articles out there we can share.
Powell was one too, right?
Powell's one. Yeah, several streets. And I would say it's something that we're continuing to improve upon is data collection. We're committed to doing more and trying to evaluate most, if not all, projects. We're not gonna be able to get to every single project, but yes, speeds, crashes, and volumes are all things we're looking to measure.
Volume being volume traffic.
Motor vehicle traffic, oftentimes bike usage, people walking oftentimes as well.
And I also shared the 10 stats in the chat for if that helps anyone on mobile or another issue. And sorry, this isn't ideal either.
Thank you, Jeremy.
I think one thing I've noticed over the last couple of years is I thought reckless driving would be the unifying issue that would rally everybody to care about safe streets. And I think once we started plopping down the DPW interventions, we found out apparently everybody didn't want to stop reckless driving as much as they told us they did. Because as we've seen, we've got a lot of pushback on that. And I think that's because I don't know like what portion of high injuries and deaths is just attributed to reckless driving or just somebody doing 40, which people would not consider reckless driving. I think it's going to be important going forward that we shift the narrative away from reckless driving and just what everybody considers normal driving. It's the real issue. People doing 40 down the street in the 30 because they think, oh, it's just 10 miles over, but we know how much rate of injury and potential for death goes up just at that 10 miles per hour difference. In this data here, a lot of it is the simple stuff we thought was already taken care of. 70% of people dying because they didn't have a seatbelt on. I thought everybody wore a seatbelt. That's news to me. So I think broadening the messaging outside of we're here to battle reckless driving and starting to talk about all this other stuff that we think is minor and simple and some stuff we've been talking had already gone away is going to be important because I think that's more unifying vision because everybody says I'm not a reckless driver. Most people are not reckless drivers. Reckless driving, as you know, people swerving in the bike lane doing 50, 60 down the street. But I think most people are, not safe driving. And that also is an issue. And I think that's get more people say, okay, now I can see how these interventions, while they might be slightly inconvenient for me, it's better for us, and it's actually tackling the bigger issue.
Yeah, piggybacking off of Montavious too, just with the especially number one of the speed limits. I think it's a great refrain we have to keep hitting. Just kind of on a personal note, I can say the school I work for is right on Highland and 17th, right? And as many of you know, there were those protected bike lanes installed west of 35th to Valete on Highland, and now those are going to be expanded to 20th this summer, and then eventually I think to 6th Street next year is the plan. And I have several students at my school who bike down Highland from around the near west side to school. And I have seen personally like how they are obeying all the traffic laws and riding just as they should. And they still can almost get run off the road. And yet I've even talked to some of their families when I have brought up, isn't this exciting that we are getting protected bike lanes? I've heard a couple of notes of, oh no, is it going to be too hard to drive around? Or like, are we going to have to move too slow now in our cars? And, I think a lot of that is also just the idea of the change, and it's something we don't know is happening. And maybe people are just, we are all creatures who like what we like. But just for me looking at that and talking about the road diet and how the lowering of speeds is good for everyone is just a really great thing to keep in mind. I think a great refrain I want to keep echoing.
Yeah, and that's where we want to do some, professional message testing and research to figure out, how can we make the best case that resonates for different groups. Because I think you highlight that it is a bit of a surprise if even parents whose kids are benefiting from these changes are still, having reservations.
Yeah.
We need to sharpen how we talk about this, and be willing to withstand, some criticisms, knowing that we're doing the right thing for the most people. It's a tough one.
So I guess in terms of the action plan, the timeline is to keep getting feedback and eventually draft something that would go to the Common Council. Is that right?
Yes. Yeah. So public input will close April 15th. Then it'll be kind of plan writing time and drafts reviewed and hopefully a draft could be presented to at least a committee before summer recess, but we'll see how this goes.
Would this
The main
be,
thing being, I'm sorry.
would this be incorporated into like a comp plan, or where would this action plan get incorporated?
There's no plan right now to have it incorporated into a comp plan, although Monica, I don't know if you want to speak to that idea. I think actually part of what needs to happen with Vision Zero as well is having all the departments talk about, what sort of oversight makes sense and structure. And that could be one of those questions too.
Yeah, that, I don't have an exact answer right now, but that might be worth talking. Me, you, Mike, there is some, precedent for adopting like DPW plans as part of the comprehensive plan. So yeah, maybe worth discussing.
Yeah, thank you. We'll do that. Well, that I appreciate people's thoughts for today. I can share the survey in the chat, but I also can send out an email that actually has like a little bit of background information and an invite that's a little easier for you to then send out to your networks.
Oh, sure, so whatever works.
Yeah, and I mean, I can do both. I'm happy to just know that if you don't want to have to write the stuff to share it, that's fine. But so here's the link for the online survey, and then an email will be forthcoming that'll have some social media images and some text that makes it a little easier to share if you'd like. I don't know, Mitchell, if you think there's time to try to look at the dashboard together, or if it's okay if people do that independently. It's up to you.
I think we can do it independently. If you're able to send out or if it's okay to share the link, or like at least
Yeah.
amongst committee members, or more widely.
Right, so I did share the link in the chat, and I guess I just asked, like, you don't share it publicly. This is really like in a testing kind of mode. And it's more just like out of respect for the other dashboard, and that we happen to finish our dashboards at the same time, and I don't want to steal the county's thunder right now. So there's nothing actually secret about it, but I appreciate if we can just give them their time in the sun, because what they did is really great for all the surrounding communities, that each community can now have a dashboard who didn't want to kind of build their own.
Yeah, it's the Milwaukee County Motor Vehicle Collision Dashboard is the phrase if you're looking for it. But it's, yeah, theirs is a different angle, I think. A lot more going on there. But
Right. And even their title, I think, just reflects kind of a different angle. It's a motor vehicle crash dashboard, and so far we are calling ours the Milwaukee traffic violence dashboard. I am very curious if people think that's too much, or if you have other suggestions for a title. We haven't, yeah, people's opinions here would be really valuable in thinking about if that's the right name.
Traffic murder dashboard. Get wild with it.
I like that.
Cool.
We're not going far enough.
Real people's lives being lost when we got the solution.
mhm.
I will say one like 2.0 version of the dashboard that I would love to do, which I should give a shout out to, I think it's Louisville, somewhere in Kentucky or Tennessee. Their dashboard includes links to media coverage about each victim. And that often can give you like that humanizing angle and a photo. And I think, remembering that these aren't dots on a map, they are real people, and any way we can do that is helpful. I will say one of the problems is we don't always have media coverage about each person. There might be a tiny blurb about the crash, but that's not the humanizing part we want to add. So If there's anything, I think there's at least one media person in the room. Having coverage of the victims and humanizing them and telling their stories, I think can help our community, realize it's worth slowing down, and there's a huge cost to what we're doing currently.
Yeah.
Well, thank you. I really appreciate the time today, and I know for me those 10 facts just like kind of bounce around in my head, and if anybody has any ideas or comments that they want to share at any time based on that or anything else you experience, please be in touch and share, especially in this planning process and at the beginning of Vision Zero. We're in a big community brainstorming phase, and we need creative solutions to these tough problems. So I appreciate anything people have to share.
Yeah,
And Mitchell, I can turn it back over to you.
Yeah, thank you. Thanks for sharing all of that. I look forward to kind of seeing the plan develop and the recommendations in there. Did any committee members have any questions before we move on? No. All right. Thank you, Jessica.
Thank you all so much.
So that was the only non-regular agenda item for this month. So we can move into going through all of the work groups and sharing any updates from those if they have them. Barry, did targeted improvements meet or discuss anything or have anything to share?
Nah, Mitch, we didn't meet behind your back.
Sounds good. Projects didn't meet.
No.
I don't know if Anna joined or if anybody from policy, you're also on policies, right? Did you meet? So it sounds like no work group updates for this month.
No.
Sounds good. I guess so that we can move on to new business. Is there anything we wanted to discuss next month? I know that there are some projects that are closer moving along in the design phase, Lisbon being one. Is that something that the projects work group would potentially have a recommendation on? Montavious. For the projects work group, I think it was Lisbon has some more final designs. Is that something that the projects work group would look at and have a recommendation on potentially?
Yeah, we can take a look at it and so have a letter or, make sure we get, I don't know if there's additional input that they're seeking or this is kind of getting towards the end of the design phase. But I think that's one that's, since it's on the table, it's a major thoroughfare. We can look at that, and
Yeah,
if need be, we could bring a letter.
I think we sent a letter last year related to it. So I think the designs do kind of are in line with what we recommended then. So it's possible that, there's nothing new to recommend. Not aware of any other well, I guess there are a lot of projects, but I don't know if there's any that we're interested in weighing in on at this point.
Well, right now, we for sure want to weigh in on Sherman Boulevard since that public comment period is very much ongoing.
It's a good one too. So I'll add those as potential agenda items. I'll do my best to follow up before we meet next. Is there any other new business things we wanted to discuss next month? Anything from DPW? No. All right. Easy enough. And with that, we can move on to events and announcements. Does anybody have any events or announcements? I know that there's the Lisbon meeting is next week. Anybody have the dates off the top of their head? All right, here it is. The West Lisbon Avenue Public Involvement Meeting is next week, Tuesday, March 19th, from 4:30 to 6:30 at the St. Margaret Mary Parish Center on the corner of 92nd and Cap. Michigan, that's another good one. Michigan is also next week. I think it's Thursday in the middle of the day. Let's see if I can find the details quick. Yeah, Thursday, March 21st, 11 a.m. to 1 p.m. at the 3rd Street Market Hall Starlight Room.
I've got an event. Next Tuesday, we're kicking off an effort over the next several months to organize a grassroots community-led transit advocacy organization and coalition with the kind of leading effort of Mobilize. Right now, the organizing principle is 27th Street and the BRT that's coming. And our first roundtable session is next Tuesday, March 19th, 9 o'clock to 10:30 at 3136 West Kilbourne. And it's open, and this is really the first one of 4 of these meetings, but there will be additional engagement opportunities throughout the year. All this is in an effort to make a regional transportation advocacy organization, including our surrounding suburbs, especially with 27th Street hitting 4-5 municipalities. And so we're looking for additional people who want to be involved and support and really build this out so we can broaden the team and broaden the table who cares about transit and making it connect with more and more people's lives.
Do you have a name?
We don't have a name yet.
Oh, it's first meeting next week.
This is first meeting.
Excellent.
Right now, we're calling it Reimagining 27th Street.
Any other events or announcements from committee members or the public? We do have our monthly bike ride last Friday of the month, which is the 29th. This month we're ending at Oak Brewing in West Dallas. Starting from Red Arrow Park, or leaving from Red Arrow Park at 6 p.m. On the 29th. There are no other events and announcements. I would hear a motion to adjourn.
Motion to adjourn.
Second.
Got a motion from Barry and a second from Montavious. And with that, we are adjourned. Thank you all. Thank you, Jessica, for presenting. Hope everybody has a great weekend.
Thank you, everyone.
Thank you. Bye.
Bye, everybody.